So today we will do the Pterygopalatine fossa. Or Pterygopalatine Ganglion. So it is a peripheral parasympathetic ganglion. It is made for the lacrimal gland or the tear gland nerve supply. Anatomically, it is situated in the pterygomaxillary fissure, which is formed on the posterior or the infratemporal surface of the maxilla and the pterygoid plates of the sphenoid bone. So this fissure contains Pterygopalatine ganglion hanging by two roots from the maxillary nerve. If we see the Pterygopalatine fissure, so anteriorly it is bounded by the infratemporal surface or the posterior surface of the maxilla, and posteriorly it is made by the two vertical plates, medial and the lateral pterygoid plates, and superiorly it is bounded by the floor of the orbit with the inferior orbital fissure. So these are the boundaries. The medial boundary is formed by the palatine bone, and laterally it is open to the infratemporal fossa. So here lies the Pterygopalatine ganglion. In the posterior wall there are three openings are there. The uppermost is the pterygoid canal, and then the pterygoid canal contains the nerve of the pterygoid and the vessels. In the upper part there lies the foramen rotundum, which contains the maxillary nerve. So these are the three openings in the posterior wall of the Pterygopalatine fossa. As we know, this is a peripheral parasympathetic ganglion, and it is hanging from the maxillary nerve, which is passing after taking origin from the bones. It passes on the lateral wall of the cavernous sinus, then it enters the foramen rotundum in the middle cranial fossa, and from here it appears in the floor of the orbit, where it passes through a groove made for the maxillary nerve. Sometimes this groove is converted into the canal due to the development of the bone over it, and ultimately this maxillary nerve then comes out of the infraorbital foramen as the terminal part of the maxillary nerve, which is called the infraorbital nerve. And this infraorbital nerve is a sensory nerve to the face. Its branches supply the lower eyelid as a palpebral branch, the lateral surface of the skin of the nose, and the skin of the cheek up to the upper lip, skin of the upper lip, and the mucous membrane. So this is the maxillary nerve termination at the infraorbital nerve. In this pterygopalatine fissure, the pterygopalatine ganglion is the largest ganglion, is hanging with the base upward and the apex is directed downwards. By two routes. As we know, this pterygopalatine ganglion is hanging from the fifth nerve, but functionally it is related to the seventh nerve. It is the, in other words, this ganglion is for the lacrimal pathway. As we know, in the brain stem, at the level of the pons there lies the lacrimatory nucleus, cranial to the superior salivary nucleus, which is made for submandibular and sublingual gland. And this is the parasympathetic nucleus, that is the lacrimatory nucleus situated in the pons. And from the pontomedullary junction, there arises the facial nerve. As the facial nerve goes around the abducent nerve, as the example of neurobiotaxis, and elevation is called the facial colliculus in the dorsal surface of the pons. So this is the facial nerve nucleus and the abducent nerve nucleus. So these preganglionic parasympathetic fibers, the secretomotor fibers made for the lacrimal gland, accompanies the facial nerve, and they come with the facial nerve. As we know, the facial nerve is made for the face muscles, the motor. So this nerve comes out of the stylomastoid foramen. After it goes into the pitous part of temporal bone, and it make a geniculate ganglion on the roof of the middle ear, and then it goes as through the stylomastoid foramen, the posterior wall of the middle ear, and it comes out from the stylomastoid foramen to go into the face to supply 5 branches: the temporal, the zygomatic, the buccal, mandibular, and the cervical. So from this band of the geniculate ganglion in the pitous part of temporal bone arises a nerve. This nerve is called greater petrosal nerve. And this greater petrosal nerve, it passes leaving the pitous part of the temporal bone and horizontally running in the forward direction, and it enters the pterygoid canal, which is situated here. just in front of the pterygoid. So it is coming from the roof of the middle ear. Then related to the anterior wall of the middle ear, in its lower part, there lies the internal carotid artery, and it is covered by the sympathetic plexus around it. A nerve from this plexus also accompanies the greater petrosal nerve, and it also goes into the pterygoid canal. So both nerves are the nerve of the pterygoid canals. This sympathetic trunk is called the deep petrosal nerve. So greater petrosal nerve and the deep petrosal nerve both are the contents of the pterygoid canal, which is situated in the upper part of the lateral pterygoid and medial pterygoid plate of the sphenoid bone. Out of this, the greater petrosal nerve it enters the Pterygopalatine ganglion and it relays into it. And the postganglionic fibers, they arise from here, and through the one root it enters the maxillary nerve. And through this maxillary nerve, these postganglionic parasympathetic fibers, they accompany the branches of the maxillary nerve, that is the anterior and the middle superior alveolar nerves, and they supply the alveolus. And these postganglionic fibers at the greater petrosal nerve, they enter it. The sympathetic fibers, they are already postganglionic, coming from the superior cervical ganglion. They also go into the ganglion, but they do not relay, and they also go through other route, and they go to the supplies the various branches, the orbital periosteum. Then it has got the palatine branches, which supply the hard palate. Then it has got the pharyngeal branches, which supply the pharyngeal muscles. So they are the orbital, and they are nasal branches also. They supply the mucosa of the nasal and the nasal glands, the goblet cells of the mucous glands of the nasal mucous membrane. They supply filling the orbital periosteum and the palatine ganglion, palatine process, and the pharyngeal branches. So they have got the orbital, they have got the maxillary, the palatine, and the pharyngeal branches. They go to the different parts as they mentioned. Now the facial nerve, as we know, it has got the goes its course to supply the muscles of the face. At the same time, the maxillary nerve in the face has got the sensations supplied by two branches. One is called the zygomatico-temporal branch, and one is called the zygomatico-facial. The zygomatico-facial branch supplies the sensations over the cheek of the skin. It is sensory. And zygomatico-temporal branch, it supplies the skin over around the zygomatic bone. and one of the branch of the maxillary nerve also goes to the in the orbit to reach the lacrimal gland, which is situated in the superolateral aspect of the orbit, as here lies a smooth groove. This is called the lacrimal groove for the lacrimal gland. So this lacrimal branch of the maxillary nerve is already supplying the or reaching the lacrimal gland. Now there is a communication between this lacrimal branch and the zygomaticotemporal branch. So this communication, the postganglionic fibers, they enters the maxillary nerve, then into the zygomaticotemporal nerve, and then the communication between the zygomatico and the lacrimal nerve. Now they enter the lacrimal nerve, and these secretomotor fibers, they reach the lacrimal gland. So this whole course of the fibers of the preganglionic parasympathetic fibers comes out of the brain through the facial nerve, reaching up to the geniculate ganglion, and then they accompanies the greater petrosal nerve, and through this greater petrosal nerve they relay in the ganglion, and then the fibers, the postganglionic, they reach the lacrimal. So this is called the lacrimatory pathway. So the pterygopalatine ganglion has got two routes. One is the secretomotor, that is the parasympathetic, and vasomotor fibers. They come from the deep petrosal nerve, which is formed by the postganglionic sympathetic fibers. It has got another route that is called the sensory route. The sensory route comes from the periosteum of the orbit. It comes from the palatine area, the hard and soft palate. Then it comes from the pharyngeal mucosa as the sensory branches, and from the nasal mucosa also as the nasal branches. So all these sensations usually enter through the maxillary nerve and reaches the trigeminal nerve, but they may pass through the pterygopalatine ganglion, and then they enter into the proximal root of the pterygopalatine ganglion. From here they enter the mainstream of the maxillary nerve, and as we know, the maxillary nerve is also arising from the pons, the trigeminal nerve, the ophthalmic division, maxillary division, and the mandibular division, all arising from the pons. So this is the sensory fibers are reaching through the maxillary nerve, because this is the only sensory afferent nerve. So these sensations, they reach the trigeminal, the fifth nerve in the bone. So this is called the pterygopalatine ganglion with all its branches, that is the orbital branches. It has got nasal branches, it has got palatine branches, and it has got pharyngeal branches. So this ganglion is very much involved in the hay fever. The hay fever involves the rhinitis and all the mucous membrane of the orbit, nasal cavity, the mucosa of the hard and soft palate, and the mucosa of the pharynx. They are involved because of the connection of these areas with the branches, sensory branches of the Pterygopalatine ganglion. That's why it is called the ganglion of the hay fever. So that's all about the Pterygopalatine ganglion.